Welcome to Dr Joe Unplugged. The topics discussed in this podcast will reflect my opinions and are not in any way to be regarded as medical advice. Low back pain is a very common problem. In fact, almost everybody will experience some low back pain at some point in their lives, and chronic low back pain is a major cause of disability. And we also know that it has been treated to a fair degree over the years, certainly up until maybe the late 20-teens, with opioid analgesia. And for those people not familiar with with Purdue Pharmaceuticals and the Sackler family, you can watch Dope, Sick or Painkiller. I think they're on Netflix, one of the streaming services. And just shows how dosing people up with more and more opiate medication didn't end particularly well, and that includes significant increase in numbers, like massive numbers of overdose deaths from these medications, like over 100,000 a year. So treatments that don't involve pharmaceuticals don't tend to get a lot of airplay. Acupuncture eases chronic low back pain, boosts physical function. Older adults with lower back pain had less pain and improved physical function using acupuncture compared to standard treatments, an NIH clinical trial showed. According to this, and we'll put the link in the description as always, 1/3 of older Americans experience chronic lower back pain, and typical treatments involve medication, surgery, and physical therapy. Now, surgery, unless there are some structural abnormalities, is not going to help with the low back pain, in particular if it's from muscles or ligaments. If there is some structural abnormality with the disc, then it may do, but again, specific circumstances. Medications, no, painkillers don't cure low back pain. And anti-inflammatory medications, they are used. There's no evidence base for them to work. But they can have a short-term effect, but they don't deal with the underlying problem. And certainly painkillers, all they do is alleviate the pain temporarily. And as we know, with opiates, it doesn't necessarily end well, and people often end up taking higher doses because the effectiveness wanes off. We saw and this is with acupuncture, we saw a decrease in pain-related disability. We saw improvements in physical functioning. We saw an impact on patient-reported anxiety. These effects were sustained from 3 to 9 months after the time that people received the treatment, suggesting that a course of acupuncture can actually result in sustained benefit, said the lead author. Now, acupuncture, again, emanates out of China, and it's the use of fine needles that are applied to particular areas of the body where the pain is. Current national use remains at about 2% in America, and is probably comparable in other countries. It's not promoted. And I'm not saying that it should be promoted as such. You don't want to see ads on the TV for acupuncture, no. But yeah, compared to medications, and if you like big pharma and the money thrown at the promotion of medications, there's no money thrown at the promotion of acupuncture. And in fact, because of its origins, it's still treated with some degree of skepticism by doctors, and also sort of seen as, where's the evidence? Well, the evidence is there and it's in. This study was over 800 adults aged over 65, different regions in America, and they were randomised to usual care or acupuncture. Again, we don't have to go through all the finer details. There's some statistics in here, but essentially, the people with the acupuncture had improvements, as we said before, in their pain, their functioning, they're less disabled, less anxious. And if you're less pain and you're able to do more, you're going to feel less anxious. And if you feel less anxious, you're going to sleep a little bit better. And if you sleep a little bit better, that in turn is going to improve your pain the next day as well. Now, in America, the investigators make a note here that licensed acupuncturists can't directly bill Medicare, and that's the American Medicare, without a supervising Medicare-approved clinician, and that's a barrier to access. And in Australia, there are also some barriers to access, albeit possibly a little bit easier to access than in America. And I can't comment about the EU or other jurisdictions. You won't have seen this study, in the mainstream media. Whereas if there's a study promoting the benefits of some medication, you'll typically see it in the mainstream media. If there's any study that links something to cancer, whether that link is the most tenuous or not, or any actual cause or effect, again, you'll generally see that in the mainstream media, but not something like this. This data actually, and I'll put my hand up on this, actually does surprise me a little bit. I'm familiar with acupuncture. I think it does have a role, but this is actually quite impressive. If there was a medication that had this effect, you'd certainly be hearing a lot about it. And if it wasn't, in Australia on the PBS, you'd be having or on the registered by the TGA, you'd be getting a lot of people arguing for it. Simple things do work. And acupuncture is one of those relatively simple treatments. Now, it does need to be done by somebody who's trained and skilled in that area. Now, personally, I'm not, so it's not something that I'm going to personally do because it's not something I'm trained in. But doctors and physios and Chinese medical specialists can be trained in it and can perform it. And look, it wouldn't surprise me if there is some degree of operator dependence. So, some people, some practitioners are going to be better at administering acupuncture treatment than others. That wouldn't surprise me. Again, some doctors are better than others, some physios are better than others. It's not 100% that everybody is exactly the same, has exactly the same skill sets. But the real kicker in all of this is that after 6 months from after treatment is finished, there's still improvement. So that's saying that it's doing a little bit more. In fact, it is doing more than just temporarily easing the symptoms. Now, again, there's no mechanism for this, but my suspicion, if the pain is reduced and that has enabled people to be more active and particularly do more exercises, and that would include back exercises, then that in turn is helping to strengthen the back muscles and make people more resilient and make those muscles more resilient. And as we touched on before, if the pain levels are reduced and that improves sleep, then better sleep also improves mood and also improves pain perception. So again, in the next day, you wake up, you've had a better night's sleep, your pain doesn't bother you quite as much, you're able to do more, you feel better about the world, it becomes a self-generating virtuous cycle. Look, like all studies, it has its limitations, and one study doesn't prove, doesn't change the whole world. As always, the researchers are going to call for, more research to be done. But I think, acupuncture goes back hundreds, not thousands of years. If anybody's got an exact date it was first used, put it in the comments. I'd be interested to learn. But it's been around for long enough, and there's enough real-world data that shows it's going to benefit people. Is it going to help everybody? Nothing helps everybody. There's not a lot of downside. And really, nothing is absolutely side effect free, but acupuncture is relatively close to side effect free. It's almost, and I do underline the word almost, impossible to damage any major blood vessel or nerve with use of needles. They just don't go that far into the skin. It's like we're literally talking a millimetre or two. So the side effect profile is quite benign, which means worst case scenario, if it doesn't do that much, well, at least you can't overdose and have a fatality from it. Alrighty, so what's the take home out of all of this? We do need to be thinking more about non-pharmaceutical treatments for chronic pain in general, and in this instance, chronic low back pain, which is a very common cause of chronic pain in particular. And that it doesn't come as a pill is fine. We need to be open to looking at treatments like acupuncture, dry needling, massage, and obviously exercises as well for low back pain. Now, again, not such that you injure or aggravate yourself, and that's where talking with a physio or a trainer may be useful. But thinking a little bit more about what might I be able to do that doesn't involve taking tablets is always a good question for us to be asking in circumstances such as this with the chronic low back pain. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please like, share, and consider subscribing. Tell your friends. If there are topics you'd like to see covered, be in touch through the chat or email info@drjoe.net.au. We'll be uploading new content each Monday, and soon we'll be putting these videos out on X. You can follow me there at Dr. Joe's DIY Health.